Welcome back to the channel, ladies and gentlemen. I have been away for a while. As last time I told you, I broke my leg, so I just had surgery. Everything went great. I was able to save my ACL, and so I'm just healing bones. So at this point, I thought it would be appropriate to come back and tell you my protocol for how I am accelerating and optimizing my recovery. Now, the first thing that has to happen when we break a bone is there's an immune response. We have white blood cells and macrophages rushing to the area of injury, and the macrophages are going to take care of all the detritus, all the debris. The white blood cells are going to initiate that immune response. Now, to speed this process up, or rather not to let it slow down, is to keep your blood sugar as low as possible during this process. So hyperglycemia severely retards this process, which is why diabetics tend to heal more slowly than non-diabetics. Now, as you know, I'm a big proponent of carnivore and ketogenic diets, so I will be on my full carnivore diet while this is happening. And now the next part, we have to actually start rebuilding the bones. So we want to make sure that we have enough of the raw materials to do so. Now, bone is made of three main constituents: collagen, water, and minerals. Now, as far as the collagen, there is collagen in some meat in small amounts. There's even more collagen in things like sinew. So I've been eating some of the chewy parts of the bone, or the meat rather, that we don't normally find very appetizing. And along with that, I have been taking a collagen protein supplement. Now, mainly we'll be focusing on type 1 collagen involved in the actual bone, but also type 3, and this has all three types, so have all my bases covered. Now, as far as minerals, we all know that calcium is a main one, but there's also phosphorus, magnesium, silicone, iron, and then the trace minerals: zinc, copper, boron, selenium, manganese, and strontium. Now, I could go out and get a supplement for each one of these, or a general mineral supplement, but can you think of a way that we could get a whole food source to have each one of these minerals in the perfect ratios for bone? Did you guess bone? That's right, it's bone. But instead of actually chewing on a piece of bone, that might get a little hard on your teeth and whatnot, they do make bone supplements. So this is a powdered bone supplement called Bone Matrix from the people at Heart and Soil. Really good. That's going to have not only the minerals in it, but also some of the peptides associated with bone that you're not really going to get anywhere else. So that's a big one as far as my supplement stack. Also, arginine, glutamine, glycine, lysine, leucine, valine, and isoleucine are all going to have their own special properties as far as inciting collagen synthesis and ossification of bones. But if you're getting enough protein from quality animal sources, as I am, you don't really need to worry about supplementing with those. Now, as far as vitamins, there are several vitamins that are going to be important. For the sake of time, I'm going to only talk about two. That is vitamin D3 and vitamin K2. Now, vitamin D3, as we know, is very important for a number of things, but it is going to help get all of these minerals absorbed into the bloodstream as best they can. Now, vitamin 2 is going to help get them from the bloodstream into the area of affect. So both very important. I will be supplementing with both of those. Now, on to the pharmaceuticals. As far as pharmaceuticals, I will be taking first and foremost a beta blocker. Now, most of you have probably heard of beta blockers for cardiac patients, treating arrhythmias and things like that. But for this particular process, whenever we have a traumatic injury or a very invasive surgery, the body is going to go through a sympathetic nervous response. So that's going to include stress hormones, norepinephrine, adrenaline, cortisol, all of these sort of fight or flight chemicals that we associate with a sympathetic response. Now, it's great if we're trying to get away from a predator in the wild, but it's not so great when we're talking about healing. Now, a beta blocker is going to actually activate beta receptors on the heart, going to slow down your heart rate a little bit, and it's going to bring you from that sympathetic state into a parasympathetic state, much more conducive to recovery, much more conducive to healing. And there are great studies in clinical settings of how beta blockers actually improve the survival rate quite markedly of people in very traumatic accidents. Now for the second thing, big one, growth hormone. Growth hormone, we've probably all heard of growth hormone. Growth hormone doesn't actually create growth in and of itself. It's a bit of a misnomer. I prefer the term somatotropin. But mainly what growth hormone do is it's going to initiate a number of downstream pathways that are going to lead to a lot of good things as far as healing. So it's going to primarily incite the production of IGF-1 in the liver. And IGF-1, along with fibroblastic growth factors, epithelial growth factors, IGF-1 is an acronym for insulin-like growth factor 1. So like insulin, it combines, or it shares a binding protein with insulin, and it is another very universal peptide hormone. Almost everything has a receptor for it. IGF-1 is going to facilitate for osteoclastic, osteoblastic, and fibroblastic processes. All of these different growth factors are going to help in actually taking these source minerals and incorporating them into the actual, what we call, endochondral ossification of the bone, so the actual bone deposition. Also, we're going to be stimulating stem cells, those stem cells on the periphery of the injury, sort of like blank cells. We're going to encourage them to be included more quickly than they would be otherwise without the additional growth hormone. Now, the next pharmaceutical that I would be using, if it were legal in my country or I had a doctor's prescription, would be oxandrolone. Oxandrolone, trade name Anavar. Now, it is actually an androgenic steroid, but it is dosed at about 5 milligrams per day, so a very mild dose, and it is going to do one main thing, and that is going to increase these mRNA transcription factors for the purpose of collagen synthesis. This increase in pro-collagen mRNA in fibroblasts, and basically what that means, it is going to contribute to the actual signaling from the mRNA to the DNA to actually increase the response of specific genes that are associated with collagen synthesis. And it is very powerful in this regard. Even at such a low dose, it isn't going to cause things like hypothalamic pituitary suppression or any kind of toxicity or anything like that. So pretty benign, but very effective. And so that's pretty much it. That is sort of my quick and dirty protocol. It has been going very well. I am about to start physical therapy. I'm putting weight on it now. It's starting to feel a lot better, and I will be on my way to doing legs like I love to do, like I love you. Thank you for watching. I'll see you next time.